Hello, I'm Dr. Chris Erickson, owner of EHS Physical Therapy and Chiropractic. Thank you so much for joining me on this video. I can't wait to inform you, educate you, help you make the best decision possible for your rehab and recovery journey. All right, I think the first thing that's important to know is that you don't have to see a primary care physician or doctor first in order to get help from a clinic for your muscle, spine, or joint pain, okay? The only reason that might come into play is if you're choosing to use your insurance, which I will cover later. Then there are certain insurance companies that do require a referral. But for right now, just know that in the state of Nebraska, it's primary care, and you can go see the clinician that you choose without any kind of referral. And then the other thing to remember is that you also don't have to go to where you're referred to, right? So you can choose to go to whatever clinic or see whatever clinician you want to. So that's why I'm going to give you this information so that you can make the best decision based off of where the location is, what kind of clinic you want to be seen, what kind of clinician you want to have help you with this problem. So just know that even though you are referred someplace, you still have the right to choose to go wherever you want to. Okay, so now which to choose, right? What's the difference? Do we go with physical therapy? Do we go with chiropractic? Those are the two most common. So let's cover physical therapy first. I'm a physical therapist by training. So really, physical therapy uses a combination of specific techniques, exercises, movements, and we help you recover from injury, from any kind of physical limitation, with the goal, the end goal, obviously, of reducing pain first, but really it's to restore that mobility and restore the movement and your functional ability to do things throughout the day. Okay? All right, so in physical therapy, we work with patients, directly, one-on-one with them, or sometimes in small groups, but really the focus or the key is identifying the root cause of the issue, not just treating the symptoms, but identifying the root cause of the symptoms. And then we develop a personalized and very customized, to you, plan of care that involves certain movements, exercises, stretches, and other activities to help you reach your goal of moving better, getting back to whatever activity or lifestyle that you want to get back to doing. So the ultimate goal of physical therapy is to help you recover from that either pain or limitation and really get back to living the best quality of life that you can. All right, let's talk more about the chiropractic side of things now. So chiropractors in general focus on the diagnosis and treatment of musculoskeletal disorders within the body, but in particular are much more focused on the spine. So chiropractors typically use more of a hands-on approach as opposed to on the physical therapy side. We do some hands-on with some manual therapy, but also a lot of movement exercise-based things. But chiropractic will typically use hands-on techniques like manipulations, right, to move the body and move the joints to help relieve pain, improve mobility, and promote healing of those injured tissues. So the goal of chiropractic care is very similar to physical therapy, right? The goal is to improve function, decrease pain, and allow people to get back to living their life the best way they can with as minimal restrictions and pain, which is why we use them together at our clinic. We find that they play off of each other very well and really go hand in hand. There's a difference in the techniques, but the ultimate goal is the same for you, the patient. All right, so here are some clinics or some tactics or some things to be aware of in a PT or a chiropractic clinic that you really should go into, having your antenna up and thinking, okay, what's going on here? It seems a little bit strange or a little bit out of the ordinary, because frankly, a lot of places are. But if they use words like subluxations and the joints are not aligned properly, and one hip is higher than the other, or your hips are out of place, or innate healing, or that all they have to do is just fix these misalignments, and the misalignments in the spine are the cause of all kinds of health problems. Then those are ones you really need to probably stay away from and be very cautious of. So, or if they're telling you that I have low back and hip pain, but all I have to do is just adjust, or work on the upper neck, and once that's all aligned up there, everything else will be fine. That's another really red flag to probably stay away. The other thing to look for is if they get you in and have a consultation And then at the end, there's a very hard sell process, or there's a long treatment plan that you have to commit to before you can be seen. Like, oh, we can't see you unless you commit to 3 times a week for the next 6 months. That's another you got to have that kind of light bulb go off in your head saying, wait a minute, that seems like it's kind of out of the ordinary for fixing these problems for me. A good clinic should really have a couple of choices, right? A couple of options for you to choose from. Do you want this many times a week, or do you want this many times a week? And they should also have some kind of payment plan available, so that if you do choose to, whether you use your insurance or whether you pay cash out of pocket, they have to make it affordable in the sense that you can, you're able to actually go and get the benefit of the service. The other ones to be wary of would be if you go to a PT clinic and the very first visit, right? They just assessed you, and so then they give you a packet of 10 exercises that, first off, they never even went through with you. They just give you a packet of exercises and say, do these at home. So you don't know if you're doing them correctly. They never checked and showed you how to do them. They also never assessed what the result or what the cause and effect was of you doing that. You don't even know if you're going to, that movement, for example, is going to make something worse for you because you never checked it out or tested it in the clinic. Some other things to be wary of, and I'm going to go into this a little bit deeper, a little bit more in another section, but if they won't help you, they won't assess you without even talking to you, they haven't asked you any questions, they're just saying, this is our rule, we won't help you unless we get some kind of advanced imaging, like an X-ray or an MRI. In most cases, that is not needed. They can absolutely, a good clinic, a good clinician, can absolutely assess you and help you without those. The other thing to look for is when you call or when you stop in, if you don't feel a positive energy in that place, if you really feel like they're in more of the transaction business than they are the helping people business. So if it's very, computerized, robotic, low affect, right? They don't have a lot of energy and a lot of positivity. I'd be wary of that place. Another thing, especially on the PT and chiropractic side really, is if they're doing the same treatment over and over again, right? Day 1, week 1 is just like week 3, week 5, week 6. I'm doing the same exercises. There's no progression. I already know what to do because I've done it, 15 times before that. That's another sign that they're just going through the motions. They're not really there to help you achieve the goals in a stepwise fashion of progressing as your body changes. They need to change the treatment plan as well. Okay, the last two that I would really be concerned about if you're interacting with the clinician or the clinic itself is if they're really more in the pain relief business, kind of that just transactional. Yeah, we'll see you a couple times, we'll get the pain reduced, but then they kick you out, right? They're not really in the, unless that's what you want, but it's just something that I see sometimes is, do you just want to be in the pain relief game, or do you want to be in the actual helping people live better, longer, healthier lives? That's two different kinds of treatment. Or the place that really speaks badly about other professions, right? They say, well, don't ever go there. They're terrible. They don't know what they're doing. Don't go to that. Don't go to PT. Don't go to chiro. Don't go to your orthopedic doctor. So we all work together, but we're all trying to help solve these problems. So the ones that really speak badly upon that, be wary of those as well. All right, so here's some other things to consider. So what kind of pain are you experiencing? What are you suffering with? Is it intermittent pain or is it constant pain? Because those are two very different kinds of things. So in general, a mechanical pain, which is what works very well for conservative care like physical therapy or chiropractic, would be considered more in that intermittent pain, right? So if I have a certain position or movement or activity, it doesn't hurt, or it at least, even if it's constant, it's very low. I can calm it down if I sit a certain way, if I move a certain way, if I position myself a certain way. But then I know that if I reach, if I bend, first thing in the morning, so movements, activities, time of day, postures, positions, somehow change my pain. It can either make me better or worse, depending on what I do. But those are very good kinds of pains and injuries to see a physical therapist or chiropractor, okay? So the other kind of pain would be if it's something more constant and maybe more driven by a chemical like inflammatory process or an acute injury, like let's just say you had trauma and you fell off, you fell down and hurt your wrist, you fell and hurt your ankle, you got in a car accident, you got hit by something. Those trauma type things, at least at first, are probably better to go to, to the ER or to someone that can do at least some triage and make sure that you didn't break something. So if you have a fracture or something more serious, that's not, where we would be of best help. Now we can help you in the beginning, at least go through those questions. And then if those red flags are raised, a good clinician and a good clinic will refer you out to the right place that you get the right care. But just think about what kind of pain, do I have? I've been having it for a while, it comes and goes, or it at least changes in intensity based on what I do, movement, that kind of stuff. So kind of figuring out, if it's something that's joint related, muscle, spine, or joint related, or if it's more like disease process related, right? So it's going to be more systemically or inside your body related. Is it because of like a disease process like MS or something different that needs a different kind of care? All right, another thing to think about is how long have you had it? So now that we know that, okay, my arm's been hurting, right? I get this pain in my shoulder, and it's intermittent, or at least changes with activity. How long have I had it? So acute versus chronic. If something's acute, it just happened, a few days ago. Whether I did something or not, that's important. Whether I have a reason, or if I just woke up with it, all of a sudden I couldn't turn and my arm was sore. That's acute is the best time to seek care, because it's usually a lot easier to change, a little bit faster to get that problem fixed. But chronic pain over time, right, 6+ months, years of pain, can still be affected, can still be fixed with conservative care. Just understand that it's probably going to take a little bit longer, and it's probably going to take a little bit more effort and time and consistency to get those to change, because it's been so long, and body systems and tissues and things have adapted and changed over time. All right, so also, is it actively, am I getting better quickly? Am I getting worse? Or am I kind of just staying the same? So most of us will innately, like if I hurt myself, I'm gonna wait a few days, because I'm like, this will probably get better. And if it feels like it's actively getting better, like every day is getting better, I'm like, it was really hard and now I can, it's feeling a lot better. You probably don't need to come in and get much help. Or if you do choose to, it's fine, but it'll probably just the treatment plan should be very short. It shouldn't take long to fix something that's actively improving. Now, the other two, if it's staying the same or it's getting worse, those are key indicators that, okay, I better do something about this. I let myself rest a short period of time. Don't rest too long. You don't want to just do completely nothing for weeks. That will not aid you. It will not benefit you. But I let myself rest for a day or so. I've been kind of working below the level of that threshold of increasing pain, and it's just not getting better. It's been a few weeks. I'm not improving, or I'm actively or quickly worsening. I could move it up, and now I can't do anything. It's even worse. Those are indications you better get scheduled with a place that can help you right away. Okay, so let's go into the insurance side of it, right? So many of you, and hopefully you watching, you have the choice of whether you want to use your health insurance or not. It's totally fine. So if you're choosing to use your health insurance, do you understand what a deductible is, what a co-insurance is, what a copay is, what an out-of-pocket maximum is? All these things play into what the cost for you is going to be. And there are so many plans. There's thousands of plans. There's thousands of different, options. So you really have to have a place that will, provide a free benefits check. Will they help you check the benefit and help you understand what you're responsible for and what your insurance is responsible for? And will they give you an estimate so that you kind of know, okay, it's going to be about, this per visit based off of, the typical codes that you use? That would be a very helpful and important thing to ask. All right, so another thing to think about is what kind of visit do you want? How long do you want to be with your practitioner? So some chiropractic offices are built on a very strictly volume model. They see 80 to 100 or more people per day. So it's very much transactional in and out of the office. You're in, it'll be very standardized. You'll go to one room, maybe like a hot pack or a little bit of, we'll call it therapies, right? A little bit of modalities. And then it's, bang, bang, rat crack, 5 to 7 minutes, and then you're out the door in probably no more than 10 to 15 minutes total for the appointment. So you really don't have the time to ask a lot of questions and really kind of dig down and get more answers. You definitely won't have time for any kind of restorative or rehabilitative exercises that can teach you. And that's okay. Like, that's that model. It's not what we do, but you have to think to yourself, what do I want? Do I want a very quick, convenient in and out that I won't have a plan for home, right? Or do I want something that I can ask more questions, I can take more time and really get a little bit deeper into the process. Also think about, what would you like to get back to doing? I mean, ultimately, what is the goal? I know that you'll say right away the goal is to reduce pain or get out of pain. And that's only the temporary or the first part of the goal. Because really, if pain was the only thing you were after, you could just give yourself a shot of morphine or take some very strong but not good for you drugs, and that would take the pain away. But that's not what you want. Most people don't want that. They want an actual solution. And it's not because just that it hurts. Yes, that's not fun, and pain is not fun to deal with. But it's because the pain is stopping you from doing something that you want to do, right? It's keeping you away from an activity, maybe a feeling like I like to go work out, I like to be active. So if I couldn't do those things because of pain, that's what I really want. It's not that I just want the pain to go away. I want the pain to go away so that I can do something else. So think about that. What kind of clinic is going to help you? One, right? That's the first part. Yes, I feel better. But then two, will they help me transition and go from that repairing phase of kind of getting things calmed down to teaching me how to move better, how to incorporate different kinds of exercise and movements back into my life, how to gain the confidence back into those movements and take me through that path, right, all the way to where I'm back to doing my activities and I feel good about it. I don't feel fearful, because really that's what a lot of people feel, is fear of movement or fear of making something worse, right? I want to try something, I know I need to do something, but I don't know what to do, so I'll either do nothing, which is the most common response, or I don't want to do this. I don't want to do the wrong thing for fear of making myself worse. So pick a place that's going to help you get through those stages, as opposed to just, I'm in 5-6 visits, the pain has gone from a 7 to a 2, and they kick me out. That's one option, right? That you can do that. But once it goes down to that 2, the chances that it goes back to that 7 within a few days or a few weeks is quite high, because you never actually got the problem fully resolved and your body restored and the tissues able to tolerate the loads of those activities again. And so you'll quickly be back into that 7, 8 out of 10 pain. I also want you to think about physical therapy or chiropractic or any treatment as, not just a commodity. So do you feel or believe that these ways of helping me are just commodities? So as long as I pick the lowest cost one, they're all the same. Or do you value the outcome and your overall health and the relationship that you build with the person and the clinician and the business? Do you value that more than just the price? Because those are two different things. If you just value price, then yes, you should pick the lowest cost one, and it may be good, it may be bad, it just depends. But if that's what you feel, is that they're all the same, it doesn't matter where I go, then the lowest cost one's probably going to be the option for you. But if you believe that, no, like, I actually am more concerned with my overall health, my overall outcome of the process, I want to feel like I had a good value and that I was taken care of and that I was listened to, and that I have a relationship built for the future, that if something does happen, I can always go to them. They'll help me along any path or any problem that I have. Then that's a different kind of clinic. It's a different kind of clinician even. So are you value driven or are you price driven? That's something that you have to decide for yourself. All right, so as we get into this, there's a couple of the things I wanted to mention. A couple of them have to do with just the style of treatment as well. What kind of person are you? How accountable are you to yourself? So accountability is another thing that you could look for and say, hey, I know that I need to do this, and I will do it at home if someone just teaches me how, right, and guides me. Or are you someone who says, no, I know, and you should know yourself, I know that I won't do it unless I come into the clinic and someone takes me through and shows me, okay, Jim, Sally, get on the table or go to that machine and do, 10 reps of this, 12 reps of that. So what, do you need someone to be there, like physically with you and guiding you through? That's one kind of, service. Or do you have the accountability and the self independence to say, well, I know that I will do it to help myself. I just don't know what to do, so I need some help. So that's one thing to look at. The other one is passive versus active treatments. So some clinics will predominantly do passive modalities, meaning heat, ice, e-stim, ultrasound, passive stretches, where somebody is doing something to you. And so then you build this relationship of reliability of saying, well, I need that person to do that thing in order to feel better. Where I'm just getting passive modalities and it feels better at the time, but then I don't know what to do when I get home because I always have to go in to have them do those things. It's a machine, it's a special technique, something where it's more passive, as opposed to an active treatment is more along the lines of working with somebody that can teach you how to move properly, right? They're going to use therapeutic activities. These are just kind of some of the words that we use: therapeutic activities, therapeutic exercises, which just means, again, specific activities, exercises, movements that you will learn how to do to be more self-aware and more self-independent, and then you can continue those at home. Along with, like when you're there, some specific treatments, manual therapy type techniques and movements, and maybe even some occasional modalities and specific or special machines. But at least there's some form of active therapy where you're having to do something to help yourself, as opposed to I'm just going in completely passive. For instance, not that it's not better or worse or right or wrong, but massage in general is a passive treatment. It feels good. I like it when I'm there, but then I have to keep going back. How long does it last? I feel better for a few days, maybe a week, and then I got to just keep scheduling and going over and over again. Versus the massage or some kind of technique along with something active, a stretch, a movement, an exercise, a program that I can continue at home to help the results or the benefit of the treatment last longer. That's two different things. I also want you to think about how soon someone can get you in for treatment, right? So if you're currently actively in pain, something happened, I had an injury, and you call a place and I say, yeah, we'll get you in 2 weeks, 4 weeks, 6. Some of the orthopedic places, doctors and certain physician offices, sometimes 4 to 6 weeks. Even some PT or chiro clinics can't get you in for 2 or 3 weeks. If you're actively in pain and having an issue, waiting that amount of time with no clue of what to do, so I'm fearful that I'm really hurt. Something is happening here. I need to get this thing fixed. I'm scared, right? So I don't know, am I going to get worse? I'm confused. I don't know what I should do. And so that time frame of waiting is not a good plan. It's not a good option to just sit there and wait, because no one's coming to save you. You have to find a place or some place that can fit you in, that can rearrange a schedule. Ask them, can you come in early in the morning? Can you come in before you open? Can you stay late? Can you see me over your lunch hour? The places that truly care about you will adjust their schedule, will push things around, because they know you're in acute pain and they want to help you. They will move things around, change, come in early, stay late, or see you over a lunch. The ones that won't, I think that's not a red flag, but a definite flag in my mind, and say, are they there just for a job? Do they just go through the motions, or are they there to help me? Also, something to consider is the number of clinicians and professionals working at the place. So I think it's fair to ask, will I see the same clinician every time? Because sometimes in certain places, one person evaluates you and then you get passed on every time you come in, or not every time, but every 2 or 3 times you come in, it feels like you have to explain your story over and over again to the next person because they keep passing you on and on to different clinicians or different workers in the clinic. So if you're okay with that, that's fine. That's one model of clinic. But if you feel like you want to create a relationship with someone and you want the same person that you saw in the beginning to continue with you, that's another kind of clinic, and you should find one like that. All right, let's get into a little bit of the advanced imaging and scan type conversation. So it's very common that when you're injured, and we talked about this earlier, you will want to go to some kind of urgent care, primary care doctor, specialist, what have you. And like, well, I need to know what's going on. So because how can I fix something or treat something that we don't understand what's going on? So you feel like, okay, I need to get an X-ray, an MRI, something to solve this, or so I get more information. So in general, unless there is some kind of reason, like a specific or an acute trauma, you were in a car accident, you had a fall, there's certain red flags that when you're dealing and talking with your clinician, when they're evaluating you, these things are going off in their brain saying, okay, wait a minute, something's not adding up to a normal or predictable mechanical spine or joint or muscle issue, then yes, we'll help you get to the right scan to get more information. But that's actually in the minority. The vast majority of people that I didn't do anything, I woke up and I have I can't turn as well, or I have pain in my arm, or I bent over to pick something up and then my back hurt, and then over the course of a week to 2 weeks it started to get worse and down my leg. Those don't require, in general, do not require advanced imaging for us to start treatment. We may need it later if the way you're responding and the movements and the activities are not, like I said, are not adding up and you're not making quick improvement. Then that might be a good thing to get some more information. But in general, a good clinician, an expert in this field of what we do, should be able to accurately assess and diagnose that problem based off of the history, the words, and your story of how it happened, what makes you better, what makes you worse, certain movements, positions, time of day, all those things. And then you combine that with an objective test. That's why we have you move forward and move backwards and turn and test things and test muscle and different strength things. So be a little bit aware of a clinic or a place that says, no, we will not treat you, we will not even assess you without an X-ray first. Okay, in the absence of acute trauma, right? You didn't fall, you didn't have a car accident, you're 45 years old and all of a sudden your shoulder starts to hurt. You don't need an X-ray. That's limited information, and really the purpose of that is just so they can get that charge, that billable charge, because they should be able to figure a lot of stuff out without taking that. Now, if after the assessment something's not adding up, then you could do the X-ray. I'm talking about the places that will not even see you or help you until they have those higher level advanced scans, X-ray, MRI, CT scans. They won't even talk to you. It's not true. I'm like, you can help someone without those scans, okay? So just a little bit more on the advanced imaging. They're very powerful. They're very important. We do need them at times, but it's it's the minority of times, not the majority. Remember that an X-ray, an MRI, a CT scan, they're just a picture. In fact, they're just a picture in time. And the way you feel that day could be different than the way you felt, 2 weeks before the scan, or even 2 weeks after. So those scans are highly, especially the MRI, is highly sensitive, right? very highly sensitive. It shows everything that's there, but it has very low specificity, meaning it can't show or prove, just looking at the picture, what's actually causing the pain. It's like taking a picture of a telephone. Okay, I see a telephone. I can tell it's what it is. It's there. Truthfully, it's there. I see it. But is it turned on? Does the battery even, is it dead? Is it ringing? Is a call coming in? Like all those things it cannot tell. So it can't tell if it's the actual source or cause. It's just one piece of information that the expert clinician needs to use, right, in the whole gathering of information to say, okay, based off of your story, based off of what we found with your repeated movements and exercises and activities and how you feel, this picture makes sense, it correlates. Or sometimes it doesn't. But who cares? Even if it doesn't correlate, and this has happened, people can say, well, I went in because I have this back pain and leg pain, and the MRI looks pretty normal. You still have pain. Like, you still have something going on. Even if it doesn't show it, you know it's still there because you're still having an issue. And then the reverse can be true. There can be an image that looks terrible, like, oh, it's all kinds of arthritic changes and degenerative this, joint, disc, whatever disease, all those fancy terms and words that really just do more fear. They do more to instill fear than they do to help a lot. It can actually be quite scary to learn and see all these things when really a lot of those things, depending on your age, depending on how much you've used, the arm, previous history, right? Surgeries, accidents, those things could be considered normal findings. Things that you would find in anybody that had that similar history, but they may have no pain. So like your right arm could hurt, take a picture of it, oh, it's got all kinds of arthritic changes and all this stuff going on, rotator cuff tears. And your left arm could not hurt, right? No pain. Take the same picture over there, it could look the exact same. So they don't always correlate, and sometimes they do. I just wanted to give you a little bit more information on that. So as we close, thank you again for watching. Thank you again for taking the time to sit with me and listen, and I really hope that it was beneficial for you. I hope that you got information and knowledge gained out of this. You are a more informed consumer of the product. It's your body, it's your pain. You are in charge of who you see, who helps you, how many times they help you, the method and mode at which your treatment happens. And just remember that not all clinicians are the same, not all clinics are the same, and you may have to try a couple of different places until you find the place that best suits you and your personality, your injury or your pain. Some people are just better, and clinics are just better at treating other things than, like if I had a neurological issue, maybe I had a stroke and I have half of my arm doesn't work, half of my leg doesn't work. I'm not going to go to a pediatric specialized physical therapist because they work with kids. It's not what they do. I'm not going to go to an aquatic necessarily, like a aquatic center, because that's not what they do. I'm going to go to someone who's very specialized in neurological conditions. If I have a spine, muscle, joint pain, right? I have a mechanical pain where if I pick my arm up, it hurts. If I set it down, okay, that feels better. I reach a certain way that hurts behind my back, ouch, that hurts, and then I can get it to feel better. Again, for those, I'm not going to go to a neurological person, or I'm not going to go to an inpatient place that only deals in post-surgical, total knees and just gets people up and walks them around. That's not what they do. I'm going to go to a very specific, outpatient orthopedic skilled person that helps deal in and fix and helps me understand my mechanical pain. So call around, use this video as much as you need to for information. You can more than, please ask these questions to places so that you feel like you are well informed and making the best decision possible for your health. Again, my name is Dr. Chris Erickson, owner of EHS, Physical Therapy and Chiropractic. Thank you.